In the UK, the demand for both nursing and midwifery are both at an historic high. But although they have the same regulatory body, the careers are widely different. And I'm going to talk about, if you're trying to decide between the two, how you can compare them in terms of career trajectory, what the lifestyle is like, what the pay is like, and all the things that you need to know to make an informed decision. So typically nursing is a 3-year degree, which is a BSc, and it's in one of 4 fields, which is adult nursing, pediatrics, so child nursing, then you can get learning disability or mental health. Increasingly, there is a dual registration where people have 2 of those 4 fields, and trusts are valuing that a lot more these days. To get into nursing, you typically need A-levels in the region of BBB or BCC, and one of them must be in a science, or you can have equivalents if you have a qualification from abroad. Otherwise, for mature students, they can do a access to higher education diploma, and they can access nursing via that route as well. Whereas midwifery is also a 3-year degree, and you can get a B.Mid or a BSc as well. However, if you do already have a nursing degree, you can do an 18-month accelerated course in midwifery. Now, places are competitive, they will interview, and they do expect candidates to have a reasonable level of women's health work experience to be eligible to enter the course. For midwifery, the grades needed are the same as nursing, and again in a science subject, so biology, chemistry, physics, applied healthcare and science, or also something like sociology as well, that's accepted. So in the midwifery curriculum, beyond obstetric stuff, they'll also want you to learn things like public health, ethics, independent decision making, so they will be looking for those sorts of skills when people apply. And an interesting thing about both courses, the NMC, the Nursing and Midwifery Council, who regulate both those professions, are expanding the amount of simulation-based training that they do. So that's quite cool actually, because you go into a room, you've got a mannequin, but it's like a £250,000 mannequin that can talk and can do all sorts of things and shows vital signs to help people understand in a real life scenario how to behave. And it is a fantastic way of learning. So quite exciting that they're increasing that amount. So what's the nature of the work? Well, it is a bit glib to just say that the nurses are the healthcare all-rounder, but they will have a wide variety of people that they're dealing with, typically across, depending on what they want to go into, a wide range of clinical settings, from hospital to GP to community and various others, even in surgery and theatre if they want to do that. It can even range from anything from corporate settings to GP surgeries to emergency care in places like A&E and intensive care for really critically ill patients. So the role can change dramatically based on people's interests, how driven they are, what areas they want to pursue in their career, but also they can advance quite far as well, which we'll talk about in a bit. Now, midwifery, on the other hand, is by its very nature a lot more narrow focused. Midwives are birth specialists. They help people through pregnancy, labor, and the first few weeks of a baby's life. They can make autonomous, real-time decisions because they have to make them in a moment, in a specific scenario, and have to kind of have their head on a swivel and really think what to do in each situation. So they have autonomy to make their own decisions like that. It's a role that is equally balanced between science and emotional support. As you can imagine, it is a very stressful situation for a person who's going through childbirth, whether it is their first time or not, and that comes with a lot of stress and a lot of difficult situations sometimes. So midwives have to be very good at handling high pressure situations, which they'll find themselves in quite a lot. So let's look at the lifestyle and the working hours. So for nursing, it can really vary. If you're a typical hospital nurse, you probably will be doing some sort of 12-hour shift pattern, unless you're on things like dermatology, which are a more 9 to 5. Also, if you're community based or if you're in a GP practice, that will be a more 9 to 5 shift pattern as well. And for midwives, 12-hour shifts, on-calls, night shifts are all part and parcel of the job, and they have to be prepared for the unpredictability of labor and could have emergencies arise at any moment. So when it comes to career progression, as you'll see through lots of NHS jobs, they are banded. So certain bands have a certain pay grade, a certain level of responsibility. Now, both nurses and midwives start at band 5, which is around £28,000 to £35,000 a year in pay. Now, both can typically progress to band 6 or band 7 as they become more senior. And nurses specifically have a few options available to them. They can become a nurse specialist. So say if you want to be a specialist in diabetes, you can specialize in that and become more senior in that particular area. They can become advanced care practitioners, and they can have prescribing rights and manage patients and become more autonomous and make their own decisions. They can also go on to become ward managers and actually have a lot of options as well if they want to go into hospital management, to go beyond band 7 and actually earn quite a lot. But around band 7, or people who go on to become a nurse consultant or a nurse prescriber, they have quite a lot of autonomy and can earn upwards of £55,000 a year. Similarly, midwives can go on to be team leaders, or they can become consultant midwives or midwife specialists, where they might specialize in something like fetal medicine. And those people, they can be involved in research and do various other things within the career, and they also can earn £55,000 to £60,000 and above a year. But what a lot of people are encouraging these days, and I'm seeing more in not just nurses and midwives, but all healthcare professions, is that they are encouraged to do an MSc, so a Master's in Advanced Healthcare Practice, which is giving people more prescribing rights, they're giving them more autonomy, and there's a lot of overlap between different areas of medicine, different areas in the hospital and clinical practice. Now, what personality type suits what? Now, of course, there's a lot of overlap, and these aren't at extremes, but if you like adaptability and kind of want to come to a shift and you're not sure quite what's going to happen, and you want to be prepared for any eventuality, then nursing might be a little bit more suited to you because of the diverse nature of what could happen and the unpredictability of it. Of course, midwives work in a team as well, but they are a lot more autonomous and self-directed and kind of working independently, whereas nurses are much more likely to be working in a team, and you need strong communication skills and all of the skills that are required to function well in that unit. Midwives, on the other hand, like I say, need that autonomous confidence in decision making and good commitment to women-centered care as well. And of course, both require strong emotional resilience and evidence-based practice, whether you are managing an emergency or helping a family through a birth. So whichever one you're interested in, the next thing that I recommend you do is gain some experience, whether that's working in care homes, going shadowing, or helping as a healthcare assistant. Get an understanding of the NHS values, what it means, and kind of understanding what you're letting yourself in for. And finally, working on and reflecting on the attributes that you have, which one they would be suited to, and helping you understand how they apply to each job, especially when you're applying and you're trying to convince somebody that you have what it takes to thrive in one of these professions. If you want to ask some questions, or you're leaning more towards one and want us to help you understand whether it's right for you, drop a comment below and we'll definitely reply and help you with that. But otherwise, if you want to compare more careers, say something like medicine, you can check out this video here where we can help you understand whether that one is right for you. Thanks for watching, and I'll see you in that video.